Gabrielle presents with a moderate sun-induced cutaneous reaction. She's 67, doesn't smoke, is slightly wrinkled by the sun and has a few solar lentigos. What we suggest is a treatment with a fractionated CO2 laser. The aim of this treatment is to induce a superficial epidermolysis that will eliminate this superficial skin and replace it with a new skin, as well as stimulating neocollagenosis in the superficial dermis. That will increase the density of her skin and make it significantly more radiant. Frédéric, 51 years old, does not expose herself to the sun much, but smokes 1 packet of cigarettes per day. She's slightly wrinkled and her pores are dilated. We're going to try a smoothing of the skin with a fractionated CO2 laser. We may be able to remove some of the small wrinkles around the lips, and we should be able to smooth the skin on the face and give her skin an appreciably more radiant appearance. An anaesthetic cream is applied to the skin on the face, like a white mask that we will leave on to work for 10 minutes. You can see that we've applied it over the earlobes, close to the lashes, and on the lower eyelids. The upper eyelids do not require treatment. We can also treat under the chin and the submaxillary area. This isn't possible with ultra-pulse CO2 lasers, for which we must limit the application to the bone edge. With this laser we can go beyond, there's no problem. We will let the anaesthetic cream take effect. This will take approximately 10 minutes. We are now ready for the intervention with parameters that were previously determined. Energy of 30 millijoules. Density of 300 spots per square centimetre and squares of 20 millimeters per side. This is a fractionated laser, and we can clearly see the areas of micronecrosis that are regularly distributed. Similar to the water released by the head of a watering can, it is therefore not the whole surface that is vaporized by the laser, but spot by spot, which leads to a less important dermal aggression and a decreased risk of burns in particular, and the scarring process will be quicker. The depth, intensity, spacing of micronecrosis areas were previously determined and chosen randomly by the operator. I've just gone over the upper lip, which is often a more sensitive area. On the lip, small wrinkles are slightly more pronounced. We can therefore do a second passage. We do not treat the red lip, white lip junction. And we will finish by treating the lower part of the face. Compared to an ultra-pulse CO2 laser, treatment of the lower jaw is not dangerous. I'm now treating behind the ear to obtain a harmonious result. I'm also treating the earlobe so that the result is homogeneous, with no areas of contrast. The treatment continues, and we must try to avoid as much as possible any overlap. I'm also treating under the ear to avoid any contrast. On the lower area, I will go over it twice instead of 4 times, as this is an area of transition with the normal skin. You can see that this is quite quick. The whole face takes approximately 20 minutes. The squares overlap very easily.
Voilà, les carrés s'emboîtent très facilement.
And on the scalp, I go into the hairline to avoid any demarcation line. Intervention is finished. We can see the entire face has been treated and that the intervention area is limited to the area to be treated. We therefore treated the hairline, ears, close to the lashes, lower eyelid. We did not treat the upper eyelid as this was not necessary. On the submaxillary area, we applied a progressively increasing intensity with fewer passages than on the rest of the face. And apart from the upper eyelids that were voluntarily left, the whole face was treated. We induced a superficial epidermolysis of the face. It will take 4 to 5 days to heal. It is important that the patient sleeps in a semi-sitting position to avoid the edema from collecting in the palpebral area. In the sitting position, the edema will decrease and care will involve cleansing morning and evening with an antiseptic soap, followed by the application of an oily cream, because we must avoid scab formation. To avoid scab formation, an oily cream must be applied, and if possible, an antibiotic, as there are 2 major risks, scab formation and infection. The risk of infection is reduced, but scab formation is possible and must be avoided. An oily cream must be applied 3 to 4 times per day, spaced out sufficiently for the skin to be permanently shiny. The skin must be permanently shiny for the first 3 days in order to make sure no scabs develop. On the 4th day, the risk of scab formation is smaller, and therefore a simple moisturizing repair cream can be used. Social isolation lasts for approximately 5 days before returning to work, with the application of superficial makeup if necessary, a tinted cream for the first 2 days. For skin care, the patient must clean her face morning and evening with an antiseptic cleansing gel that must be rinsed, followed by the application of an oily antibiotic cream morning and evening, and during the day, so that the skin stays slightly greasy. As a precaution, if the patient has a history of herpes, an anti-herpes treatment must be started 2 days before until 2 days following the intervention. We must, of course, be present to deal with potential consequences and be available for the patient in the days following the intervention.